Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hello, I'm Yolanda Vasquez. Tonight we're focusing on healthcare, how to better manage your plan, avoid costly mistakes, and get the best medical treatments available. Joining me now in the studio is Leslie Michelson. He is the author of The Patient's Playbook, How to Save Your Life and the Lives of Those You Love. Leslie, it's an absolute pleasure to have you here in our studio.
Yolanda, thank you so much. I love the great state of Maryland, and it's my privilege to be here.
And we're going to talk about some of your connections to Maryland in a second, but first let's start off by talking a little bit more about this book, because this is touted as the essential guide to getting the best health care from a broken system. Is that how you perceive the healthcare industry these days?
Yeah, it's hard to view it in any other fashion, really. I deal with physicians, nurses, patients, administrators, everybody in the healthcare system on virtually a daily basis. And they're frankly as frustrated as patients are in trying to deliver them the very best medical care that they can.
What made you decide to write this book? I mean, what problems specifically were you looking to address?
Well, there are really two major problems in healthcare today. One is the costs are out of control. We spend 50% more than all of our other global trading partners. But the other problem is we've got wild variations in quality of care. You know, my company, Private Health Management, has been retained by the wealthiest people in the entire world to get them the very best medical care. And when I look at the care that they've gotten before they get to us, it's not so great. So what I've learned is there is fabulous healthcare delivery available in the United States, but it doesn't go to the 1%ers. It goes to the people who are the most effective healthcare consumers. And I wrote The Patient's Playbook to teach you and everyone how to be that effective healthcare consumer so you can be the person who gets the very best medical care.
So let's talk about your background, because I think a lot of people at home are probably saying, so why should I listen to him? You spent 30 years in the healthcare industry, worked with a number of foundations and organizations, even starting your own company back in 2007. Tell us a little bit more about why we should listen to Leslie Michelson and your company, what it is that you do at Private Health Management for your clients.
So my career in healthcare really started, in a sense, the moment I was born, because my mother had some very difficult postpartum depression issues, and she ultimately ended up being bipolar. And for much of my life, her health was a big determinant on how well our family functioned. And then when I was in high school, I was 18 years old, my dad came home one night and said he needed open heart surgery. Yolanda, I didn't even know what that was, but it scared me half to death. So when I got home from school the next day, I called the chairman of cardiology at Lenox Hill Hospital, New York, because we lived in suburban New Jersey, to ask him to give my father a second opinion. And my dad came home from getting that second opinion. What the doctor had told him is there was nothing wrong with his heart. He didn't need the procedure, and he didn't get the procedure. My dad lived almost 40 more years and never had a heart problem. He didn't need that procedure. That would have shortened, not lengthened, his life. And since that moment, that terrible event gave me the mission in my life. I've dedicated most of my career to helping everybody learn how to become an effective healthcare consumer, because if I could save my dad's life at the age of 18 with a single phone call, each and every one of us can do a much better job for him or herself and for their families. And I have helped, over the years, thousands of people in all walks of life with virtually every single kind of medical issue, and I have seen the difference that it makes.
One of the things that you talk about in the book is that it's so crucially important for you to have a primary care physician. You say it's almost like driving without a seatbelt. But what's interesting is that I queried some of my friends, and it's interesting to find that there are a lot of people who don't have primary care physicians, or if they do, they don't like the one that they have.
Yeah, and it makes no sense to me. I've struggled for years to understand why that happens, because I talk to my friends and they tell me the same thing. But your primary care physician should be the quarterback of all of your health care. That's the person who should make sure that you're getting all of the proper prevention, early detection tests. It's someone who should listen to you. So if there's stressors in your life or other things going on, they will understand it. And it's someone who should coordinate your care if you should develop a difficult problem, and somebody, importantly, who you should listen to. Because if your blood pressure has gotten too high, if you haven't been getting the exercise you need, if you're working with too much stress without enough relaxation, all the things we know can be so destructive to our health, it's your primary care physician who should support you in improving your lifestyle, and the difference that can make is absolutely enormous. So it saddens me that so many people don't get the benefit of a good and strong and enduring relationship with a primary care physician.
So what are some of the things that you should look for in a primary care physician, and how do you go about getting that physician? Because in your book, you talk a lot about researching and actually interviewing a PCP, which I've never done before. Most people just go and say, okay, I'm signed up. But you talk about that in the book. So what should you be looking for, and then how do you go about getting that person?
So this is the most important professional in your life. It's the person who should be at the foundation of your entire healthcare team. So what I encourage people to do is a couple-step process. First, take out a piece of paper. Write down the things that are important to you. Are they in-network in your insurance? Do they have admitting privileges in the hospital nearest your home that you think is the most important? Are they close to where you live? Do they have office hours at night? Do they speak Spanish? Whatever it might be that's important to you, step one.
Okay.
Step two, talk to your friends. You remember a conversation with a friend at some point who said, you know, he or she loved their primary care physician. Circle back to them. Talk to the other doctors in your life who you like. You know, women almost always have OBGYNs.
Yes.
Ask your OBGYN if you like your OBGYN. Who does he or she use?
Right.
If you have friends who are nurses or in the medical profession, ask them. Compile a big list. And then make sure that those doctors on the list meet the specifications you laid down before about taking insurance and proximity and those things. And then pick the top three and have an interview with each of them, just as you would if you're interviewing a lawyer to do a trust plan, if you're interviewing a nanny for your child. It makes sense to interview people to get choice. And if you do that, everyone tells me you end up with a doctor who you like and you can trust, and it'll make a difference.
Excellent. We're going to go to the phones right now. We have David on the line from Anne Arundel County. David, do you have a question? David, are you there?
Physicians?
Yes, go ahead.
Okay. Well, the primary care physicians, I see the one that I have, I mean, I go there for regular checkups and for a physical once, twice a year. But I see that, you know, I'm healthy, let's say, and then I get farmed out with all these referrals to all these different things that maybe or maybe I don't need. I mean, that's a problem. I mean, the panelist there, the guest talks about I mean, I know he's the quarterback, but my question is, I mean, sometimes it becomes too much and too much strain on the healthcare society there with costs and things for unnecessary care that's needed when a patient is basically healthy.
Excellent. Great question. Thank you, David.
You're welcome.
You talk about this in your book, all the unnecessary treatments that are going on. Let's address a little bit about what David was asking about.
Sure. Thank you for that, David. And I'm delighted to hear that you do have a relationship with a primary care physician. And that's so important because many people today just use urgent care clinics, and that really doesn't serve the same need. It serves a need, but it's a different one. So most of the studies that have done in healthcare demonstrate that about 1 in 3 of every dollars in healthcare is spent on unnecessary care, and that can be really dangerous. So if you think that your primary care physician is referring you out unnecessarily to physicians and specialists that you don't need to see because you're healthy, I suggest you do 2 things. First, sit down with your primary care physician, go through the list, and give him or her the benefit of your thoughts. You clearly sound like an intelligent, intuitive, caring person who's working hard to maintain his health. See what he or she responds, and if it's not an adequate response, there are lots of other good doctors out there, and find somebody who gets you the service that you need and that you deserve.
One other tip that you mentioned is for significant problems, go to significant institutions. And we're very fortunate here in Maryland that we have several of them right in our backyard. Johns Hopkins, as I alluded to earlier, you having a local connection. That's where you received your undergrad degree. Talk to me about why it's so important to be able to search those out and how you really have no excuses because everybody lives, according to your book, within 100 miles of a major American city where these medical institutions are based, right?
You know, that's exactly right. So there's no realm of human knowledge more complex than human biology. I mean, we are Mother Nature's most majestic creation. And it's very difficult for anybody to really be at the top of the game in understanding a whole lot about many different organ systems. So the people in the academic medical centers typically do research as well as provide clinical care, and they tend to be somewhat more specialized, and they get the benefit of the disciplines in those centers. So community hospitals are wonderful institutions, particularly if you have straightforward needs. If you have an appendectomy, if you sprain your ankle, if you have a simple fracture, if you have a hernia that needs repaired, all those things are done fabulously well at community hospitals. But if you have something that's really complex, a lymphoma, I was on a telephone call a half hour ago with a friend of mine who's just been diagnosed with lymphoma, but they don't know which one. There's 67 different lymphomas. And it's a very hard exercise to figure out which one is the one that you have, because they all have different prognoses and different treatments. If you have a tough diagnosis, it makes sense to go to an academic medical center where they'll probably have more experience in what you have. But many people are reluctant to do that, Yolanda, because they fear it's going to cost more money.
Yes.
But let me give you a trick of the trade here, a secret that I've learned over the decades. If you have employer-based health insurance or Medicare, and most people have both of those, one or the other, almost every major academic medical center is in network for those insurance coverages. And what that means is that it doesn't cost you a penny more to get your care done by somebody who might be at the very top of their profession and specializes in what you need, as opposed to a local physician who's perhaps more of a generalist and may not have that expertise.
Good advice. Let's go to the phones right now. We have Donna on the line from Baltimore City. Donna, go ahead. You have a question? Donna, are you there?
Yes, I am. Hello?
Hello, can you hear us?
Yes, I can hear you.
Okay, great. Do you have a question for Leslie?
Yes, I do. The question I have is my husband has a primary care doctor, but he will be retiring soon. And the biggest problem that we're seeing is a lot of the doctors that my husband potentially likes does not use my chart or my portfolio, whereas his current doctor spends more. He spends at least 25 to a half an hour with him, but we hear from other people that their doctors only spend 15 minutes, and that is my biggest concern. Is I don't want it to be like a
revolving door.
Right.
Yes, I got you, Donna. All right, thank you so much for the question. This 15-minute time limit has come up in so many conversations that I've had with friends and colleagues of mine. Talk to me a little bit about how you can get that additional time with your doctor when really they're trying to do their job and they're trying to get so many people in. We understand why, but how do you get around that?
It's one of the toughest problems in all of medicine. Every single primary care physician I know is frustrated by the time limits that they have, by the productivity requirements that are set up for them by the carriers and the hospitals and others. So this is a really good question. The first place I would start, Donna, is I think your standard is the right thing. You really want to try to find a physician who can spend the time with you that you need, and it's worth the investment of your time to research that. One of the techniques is to ask the physician who's retiring who he or she will recommend. It sounds like you've been blessed with a very caring physician, and whoever is taking over their practice is probably going to be as caring as they are. So I would start there.
Excellent. You talk about doing extensive research in the book, and most people probably do Google and the disease or the ailment, right? But you really kind of dig a little bit deeper. What websites do you recommend people research when they're looking for, something about a diagnosis or a doctor or what have you?
There's so much information online, and so much of it can be really difficult. So you need to be very careful, particularly when it comes to healthcare, that you're going to credible sites and getting logically information that's neutral and objective and evidence-based. So there are some terrific websites. We've published them on our website, The Patient's Playbook, and they're in the book as well. I only have time to go through a couple of them, but we as Americans are incredibly generous people. We donate billions of dollars to healthcare philanthropies, and disease-specific philanthropies almost always have terrific information for patients. So if you're newly diagnosed with breast cancer, with an aortic valve problem, with diabetes, with Parkinson's, go online, identify the preeminent disease-specific philanthropy. what you'll find is they'll have education material for you, and many of them, like the Pancreatic Cancer Action Network and the Bladder Cancer Action Network, have people standing by waiting for you to call because they're there, they're caring people, they've had experience with the disease, and they're there to help you.
Excellent. We're going to go back to the phones right now. We have Frank on the line from Baltimore County. Frank, what's your question?
Good evening.
Good evening.
The reason I'm calling is you talk about changing physicians, things of that nature. But my question is, how difficult is it to have your records transferred with you? I'm always reluctant to do so because I want to make sure that my long-standing decades of records do get transferred to the new physician.
Frank, that's a great question. Thank you for asking it. In fact, Leslie's going to share with us how he shows everyone his medical records.
Sure. Frank, good question. You know, those medical records are your property as a matter of law. Every bit as much as when you drop your car off at a parking lot or you bring in your suit to the dry cleaners, it is your property that the physicians have custody of, and they are obligated as a matter of law upon your request to send you all of your medical records. And it's a routine matter. People are worried, Yolanda, that they're going to offend their physicians if they ask for their medical records. But you just tell them, listen, I travel a great deal. I'm seeing a bunch of different doctors. I think I'd like to have control of my medical information. I travel a lot, as we talked about. So I never leave home without my medical records. This little USB card that fits into my wallet has a little USB card here where I have all of my medical records on it. All one would need to do is put this into a computer and immediately comes up with a PDF that has my name, emergency contact information, the medications I'm on, my diagnoses, my allergies, and my full medical history and access to all of that. So if the God forbid should happen, and I'd get hit by a car or faint or something, the EMTs know to go to your wallet to find out who you are. And if they go into my wallet, they'll find this, and it says, these are my medical records, and in case of emergency, call my company, Private Health Management, that answers the phone 24/7, 365.
That was a good plug for private health. So, but if I'm just the average Joe, I can put that on a thumb drive.
Absolutely.
Okay.
Anybody that knows how to download files from computers, and I'm a little old for that, and you might be as well, but people, I'm sorry, but people younger than us all know how to do it, and you can just buy a thumb drive for a couple of bucks.
Excellent.
And put it in your wallet.
Great.
It makes sense.
We're going to go back to the phones. We have Carolyn on the line from Baltimore County. Carolyn, do you have a question?
Yes, hello.
Hello.
Doctor. About 20 years ago, I know it's a long time, but I had a hysterectomy. And when I woke up from it, it was a total one. I said, oh, what did you do to my back? And they said, we didn't do anything. Well, it turned into a big mess because they had to re-operate on me. They had stitched up a ureter, and it was a bad situation. Anyway, I have been left with the back problem for all those years. And I wondered, I've looked in the newspaper about these places that are called spinal institutes in New York and Philadelphia. I did call them and sent my x-rays to them. They said they could cure me immediately. This is one of those things that takes they just do about an inch on you, and then you go home the next day and you're fine. And I don't know, it just sounded too good to be true. But I've tried so many things.
So you want to know if that's a good option for you?
Yes, I do.
Okay, Carolyn, thank you for the question. We appreciate it. So you hear about other alternatives for healthcare besides an institution. What are your thoughts on that?
So Carolyn, I'm so sorry to hear that you had a complication that should never happen with a procedure like that. And it sounds like you've been courageous dealing with pain and difficulty for a very long time. Kudos to you. What I'm worried about in what you said is it sounded like it was too good to be true. You see, I believe that human beings have terrific instincts about things, and we're all old enough to know when it sounds like it's too good to be true, it usually is. So I would encourage you to continue to engage your instinct as you're figuring out to provide how to get the right solution to your problem. And you're in Baltimore County, which means you can't be terribly far from the wonderful Johns Hopkins. I'd make a suggestion to you, which is go online on the Hopkins website, identify who the preeminent orthopedists who specialize in back problems are at Hopkins, and make an appointment and see what they think. You can't be too terribly far from that institution, and I think you can probably trust the caliber and the integrity and the experience at a place with a reputation like that.
Can't go wrong when you're dealing with Johns Hopkins. Medical errors. Let's talk a little bit about that, since that's sort of a little offshoot from what Carolyn was just saying. It's huge. I mean, it's the third leading cause of death after cancer and heart disease, which is pretty significant. How many medical errors are we talking about per year, and what can you do to avoid it? Because, like, you know, she had the surgery, wasn't until after the fact.
Right, and as you and I talked about before, it's a huge problem. They're not just statistics, they're people. And it really alters and terminates people's lives way too early. We lose 400,000 people each and every year from preventable medical errors. That's the equivalent of 2 fully loaded jumbo jets crashing every single day of the year with no survivors. It is one of the biggest opportunities we have to improve our healthcare system, yet it's getting very little visibility from the policymakers and others. So my recommendation on that is I wrote an entire book to give people the guidance that they need in order to make sure that they don't become one of those statistics. One of the points I made in the book is the one that you were making earlier, the one I just made, which is if you have a significant medical issue, go to a significant medical center to see if you can get the proper care there. Excellent. Another is to make sure that your care is coordinated, that all of the physicians who are managing the different aspects of your health and your well-being know what one another are doing, so you don't run into the kinds of communication challenges that cause a lot of those problems.
Our time is going fast. I want to squeeze in another call here. We have Peretti from Harford County, or Perrette, forgive me if I butchered the name. Do you have a question?
Yes, hello.
Hello.
Yes, you were speaking earlier about that you have a legal right to have your medical records from a physician. What if they ask or tell you that you have to pay for them?
Great question. Thank you very much.
So each and every state has different regulations about the maximum amount that they can possibly charge you. And you can find out what those charges can be on a maximum level by going to a hospital's website, or some of the state health authorities have that on their website. And many of the doctors start to charge, but if you talk to them, if you've been a long-term patient, you can probably either dramatically reduce that charge or talk them out of it entirely.
Our time is going fast. We only got a few minutes left. You know, it can be difficult for some people to talk to their doctors, to even challenge their doctors if perhaps they think they're being misdiagnosed. How do you help them get through that? Because one of the things you said to me is that this book is important because it teaches you that you can do it. Right?
Absolutely. I believe that everyone can become a much more effective healthcare consumer just by following the steps and the guidance in the patient's playbook. But for people who are concerned, you see, we all hold our physicians in enormously high regard. And we put them on such an exalted stage that sometimes we deny them the opportunity of our participation in getting them the best medical care. So we could talk about how we can role play doing that.
Yes. Fortunately, our time is going fast. I want to get Grace from Calvert County in. Grace, do you have a question?
Yes, I do. This gentleman has referred a couple of times to being able to call up, if you get diagnosed with something, you can call up a specialist and make an appointment with them at no additional cost. But my question is that usually it's the insurance company that requires that you jump through certain hoops in order to be able to get that additional care. So in other words, they require that you get the permission from your primary care physician. So is it really that simple to just call up someone, a specialist?
Great question. Thank you. Is it that simple?
You know, it's not necessarily simple, but I have to tell you it's extremely important. And it is unfortunate that many of the insurance companies still put in place difficult administrative barriers to people like you getting to see the physicians they should be seeing. So sadly, you have to invest a little time on the phone, on hold, working through the bureaucracy. But with the support of your primary care physician, you will succeed in doing it. So again, I'm not saying it's simple, but I am saying 2 other things. 1, it's very important, and 2, I know you can do it.
We've only got about a minute or so left. You said one of the things that you want, the takeaway is for this book, is that people should get this book before there's a problem. Talk to me about that.
Yeah, Yolanda, that's so right. You know, healthcare problems don't come by appointment. And it's so important for when that day comes, because it comes to all of us. When you're in the physician's office and the doctor says, you know, the lab results came back and it's not what we were hoping for. Or you're in the car and the car behind you doesn't hit the brakes. All those sorts of things. then it's too late to figure out how to be prepared to make sure that you're getting yourself the best medical care. So this is a book that should be on everybody's nightstand.
Leslie Michelson, it was a pleasure to speak with you. Thank you so much for your time. The Patient's Playbook, we really appreciate your time this evening.
Yolanda, thank you.
Thank you very much. And Thursday at this time on Your Money in Business, a new online tool that aims to settle customer disputes. Thanks for watching, everybody. We'll see you soon.
This program was made by MPT to serve all of our diverse communities.
Sam, keep your mic on. Yeah. We're going to answer some questions.
Phone call for
okay. Sure.
Sure.
I didn't have time to say, and if you're hanging on, it was boom, 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 boom.
I'm happy to do it.
All right. Go ahead. Vitas from Baltimore County.